Okay, so back to evidence-based medicine. So we've talked a little bit about the FDA and some of our ways of ensuring that the medicines that we're using are safe. So what are our ways of knowing medicine? So we've talked a little bit about scientific investigations, maybe some of the animal studies that have gone on, and we'll talk more about these as well. But that's only one piece of how we know medicine. And in fact, it's quite limited actually. So we don't know a whole lot about what drugs do inside the body. We have some idea of some of the targets in there, but just as we said, hormones have multiple places that they go in the body and have multiple effects. Drugs are that way too. Anytime you're taking something, it's going to be doing more than one thing, and it's going to keep getting modified into all of these different metabolites as it goes through your body's system. So the scientific investigations and our scientific knowledge of how things affect the body is going to be very limited. It's going to be very targeted and focused in a very specific area of research. So while it's really useful, and it has given rise to new medications, and it gives rise to our understanding of disease states, it's not the end answer. It's only one part of how we know medicine works and is effective. We also have clinical experience. So sometimes doctors have been treating patients with certain things. We may not have any idea of how it's affecting the body. We only know that the patient gets better when they take it. So this would be clinical experience of your practitioner that he sees what works inside the clinic. And so this is also a very important component of medicine, and it's evidence-based. The practitioner is watching the evidence of the patient getting better. And so this also provides some explanatory models for regulating and treating a disease state. We also have outcomes research where you're taking populations of people and you're treating them with different drugs and then seeing their ability to recover from a situation or to at least get better or be maintained. And so this is going to be a very dynamic component as well. And we're going to talk a little bit more about this component in the rest of the talk today. So before we get there, which one of these do you trust the most? So I think sometimes you might say, oh, the scientific investigations or the outcomes research would make me think, oh, those are the best treatments. But I think for most of us, we actually fall into this category. We're going to our doctors and we're trusting their experience. We're trusting them when we go there and we ask, what's wrong with us? How are we going to get better? And they say, well, I think you should try this. And we trust them. So I think we do rely very heavily on clinical experience. And we also need to grow in these areas of our understanding. We need to be able to investigate these other aspects of our own healthcare and be able to then go to the doctor with some informed knowledge about what treatments are available for our condition, or we go away from the doctor after he has suggested X and Y, and we investigate ourselves and say, hey, I think I've found a treatment that overlaps in all three of these categories, and I want to pursue that avenue for my own benefit. And so some of this may include things that you can control very readily, such as diet and exercise, and maybe some of these dietary supplements that we've been talking about. You can actively research and see what scientific investigations have shown, and then discuss these with your doctor to make sure that you're all on board with the best way to treat you for specific conditions. So the one thing that we've left out of this decision-making process is the patient's thoughts and preferences. And that actually also plays a very important role, right? So patients aren't going to necessarily do the most difficult things, right? So patients don't like things like colonoscopies, for example. Those are pretty invasive and unpleasant experiences that people, want to avoid. So you don't want to have a treatment strategy, even if it's really good and could prevent the disease, if the patients aren't going to do them. Right? So if the patients aren't going to have high compliance to doing the treatment, doesn't matter how efficacious the treatment is, the patients aren't going to do it. So it has to also agree with the patient preference, their personal values, their family traditions, and it also has to be backed and enforced by authority and justice. So all of these different components also have to be taken into account when you're developing a treatment strategy, right? They have to be legal and they have to be just. They have to be available to the entire population. It's not fair if only rich people can have access to certain drugs. Having ways to make sure that everybody has access is a very important component as well. So our take-home point, there's great controversy about how to best implement evidence-based practice. It isn't straightforward, and every case has multiple options for treatment plans. And if you go to one doctor or another doctor, they're going to have different ideas about how to best treat you for that specific case. So patients and healthcare providers may not be equipped to search for or evaluate all of the best evidence. So it's hard to find really good doctors that know everything. You need to also take an interest in your own healthcare and be able to do some of that evaluation and some of that searching for the best evidence. So those are some of the tools that I want you to come away from this class with. I want you to know where you can find this information, and then I want to help you in your interpretation of it. How do you read it? How do you look at the graphs that are in those documents and make sense of them so that you can be well informed as a patient to help mediate your best treatment and maintain your health? So evidence-based medicine is going to combine knowledge analysis from all three areas of understanding medicine. It places emphasis on accountability, and it provides a reason to justify treatments. It can be tied to insurance reimbursements, right? You may decide, I want to go with treatment A option because that's the insured route, even though treatment B over here may be a little more efficacious, but I have to pay a lot of money to have that treatment, right? That's also going to come into, what is really realistic and reasonable for your treatment. So insurance does play a factor in our treatment potential. But this also provides the transparency to allow patients to find their own information. You should know what's been done as far as research goes, and any research that's been federally funded is required to post that in a public forum so that it's accessible to anybody in the United States. And this is very important. So the goals of evidence-based medicine are to have improved patient outcomes. You want to improve the health of the patient. So you're going to take the best individual clinical experience of the doctor, the best available clinical evidence there is for the efficacy of the treatment, combine that with the patient's values and expectations, and hopefully you end up with a healthy patient at the end. So in this next section, we're going to focus on the best available clinical evidence as we move forward. How do we evaluate that? Where do we find it? What types of studies are out there, and which ones should we be looking for to help us make our decisions?